Hello and welcome to Heart Matters 2025, Experts Insight for Every Beat, our special World Heart Day series. This year's global call reminds us to take heart health seriously and act early. Through these crisp, power packed sessions, we bring you leading voices from cardiology and preventive medicine to help you protect your heart and live healthier. And we are going to begin with a fascinating conversation on the role of genetics in heart health. While diet, exercise, and lifestyle are important, our genes hold powerful clues about your risk for heart disease. And knowing this can change the course of your health journey. And for the session, we are joined by our guest, Dr. Ramesh Menon, Director Personal Genomics and Genomic Medicine at MedGenome. With over 20 years of experience in India and Europe, Dr. Menon is a pioneer in using genomics to improve patient outcomes. His research, published in top journals like Nature and Nature Communications, is helping shape the future of precision cardiology. Welcome to our show, sir.
Thank you, Simran, for having me in the show. Yeah,
Thank you so much for joining, sir. So, to begin with, we would like to understand and to start this conversation that many people think that heart disease is only about our diet, exercise, and lifestyle choices. But I think there's more to it. And you often say that genetic is missing piece. So, could you explain why understanding our genes is just as important as lifestyle management?
yeah. So, broadly speaking, the heart diseases in a very simple terms, we can divide it into cardiomyopathies. Then cardiomyopathies means something related to heart muscles. Then the channelopathies, which is something to do with the electric signals. Then something to do with the blood vessels, cardiovascular diseases. So you can say like several form of these heart diseases. Uh, more it's more on the genetic side than the lifestyle. If you take the example of cardiomyopathy, hypertrophic cardiomyopathy, so it's more on the mutations of certain genes that can cause the disease, and the disease onset can be early, so then one modifies the start modifying their lifestyle and all. So on the other hand, if you take the cardiovascular disease, especially coronary artery disease, so lifestyle plays a very important role there. So it depends on the type of heart disease that we are talking about or we are dealing with. So of course, in all of these forms, genetic testing is very important to know upfront much before the clinical symptoms appear, any symptoms appear, so we can know the risk of getting any of these form of disease much earlier in life.
Thank you. Thank you so much, Dr. Ramesh, for answering that question and how it is important to get that risk assessed early in life and how, it is as important as our lifestyle management. So, we know that with some of the most common hereditary heart condition we should be aware of, like familial hypercholesteremia or, cardiomyopathy. And if we have to understand what could be the warning signs in family history that should raise a red flag, and the person should be very conscious about that heart health.
Yeah. So basically, family history, especially first or second degree blood relatives. First degree means father, mother, sibling, or second degree, grandfather or uncle. So first degree or second degree blood relatives are affected in any of these diseases. It is a, I would say, like it's a mandatory kind of thing one can consider to do a genetic screening as early as possible in life. And not only that, one member of the family, but we don't know how the genetic inheritance has come to all the family members. So all the family members need to be screened for these specific diseases, which some of the diseases can be related also, not exactly that phenotype will appear. So all of these genes need to be screened, meaning like genetic screening for all of these complications need to be done for all the family members.
Thank you for that response. And I believe a person should be very careful when if that particular person has a family history of heart attack. I think that can affect the bloodline as well. So today, how can genomic screening help identify
Yes.
at risk individuals early? And should it become a part of routine preventive health checkups also?
Yes, definitely. So basically, when we talk about, even I'm going back to the previous question on family history. So family history is one reason that you do a genetic screening. Another reason is like you can see like individuals who are having the lifestyle that they are leading. We cannot may or may not be intentionally a bad lifestyle, but due to job or their family status or circumstances, life can be stressful. So maybe some genetic reasons are there that are underlying in the family but has not expressed in the previous generations till now, due to a trigger coming from a bad lifestyle and diet. So that risk of getting the heart disease get triggered in one individual. So a lifestyle, somebody is leading a not a very healthy lifestyle, need also to be screened, because we never know that what is written inside one's DNA. Correct. So until and unless we screen for it, we will come to, and these all tests are like a once in a lifetime test. So and it has become more and more affordable, and and the awareness also is getting higher nowadays. So and so it is available in, for example, it's not only available in the urban geography, but also in the villages, small towns, all those things. These tests are available. Basically, sample collection, can blood sample or saliva sample can be collected, and these testing labs are available everywhere. So this testing can be done, and this needs to be done. If you look at the some of the Western countries, even in the Middle East, they have started the mandatory newborn screening. Actually, so newborn screening, when the child is born, then itself the genetic screen is done. So recently they have started implementing these things. So now in India, as we know, the diseases are not rare in India. So we have a unique genetic makeup. So we see a lot of rise in, especially in heart diseases, spike in certain areas. So we should be screened, as soon as possible at early stage of life. One need to be screened to know their risk, and then to, after knowing, one can mitigate the risk of getting take interventional measures, consult the clinician, and get the risk managed.
Thank you so much, sir. And I think it really helps us to understand the current heart condition and to manage risk accordingly. So let's say I heard a case study very recently that after the genetic testing, the person got to know, if I eat this, that person's body was prone to something, and that might accelerate the blood pressure of that particular person. So if he eats more of those kind of foods, it increases the blood pressure, which increases the risk of heart attack. I think that is how genetic testing is helping us to manage our life nowadays.
Yes. So a clinician can really guide, a cardiologist can really guide an individual, taking advantage of this new technology and the test, how to live a healthy lifestyle. Lifestyle, not food is one example, good example that you pointed out. Another thing is like a exercise. So we all are, do some workout, or at home, or at a place gym or something like that. So am I fit to do the certain exercise? So your doctor cardiologist can really guide you based on your genetic profile. So certain exercise, am I fit to do that? So those all things are there, especially people who have a risk of cardiomyopathy, muscular disorder, issues in the heart muscles. All those things, certain exercise is not recommended. If they overdo, physically they may seem fit, but it's not. From inside, we should know how the health status of our heart.
Very rightly said, sir. And now, as we are moving towards end of our this session, sir, but we would like to, answer the final question. So, as we mark the World Heart Day 2025 with the theme "Don't Miss a Beat." So, what exactly is your key message to the audience about discussing family history, considering genetic testing as a proactive step for heart health, or anything else you would like to particularly mention about it?
See, Adopting to a healthy lifestyle and diet is a must choice one should do. Apart from that, now make use of the latest technologies, advancement in science, discoveries and all. So these all those tests are now available in India, not only in the West. So take advantage of those tests, and it all the message lies all in the preventive wellness. So we can, once we get the disease, of course we can treat it or manage it, but it all lies in the preventive wellness. So as early you are aware, you and your clinician cardiologist are aware, they can guide you to to lead a healthy life. So it all lies there in the preventive wellness.
Thank you so much, sir. Thank you so much for sharing your insights on such important topic, especially on the occasion of World Heart Day, or let's say not this particular day, but we aim to create awareness about our heart, how to keep our heart healthy, and to live a healthy, happier life so that our country can have a healthy future ahead. So thank you so much for being part of this
Thank you.
insightful series. It means a lot that you have, scheduled this to share, to educate and aware more and more people out there. Thank you so much, sir.
Thank you.